Welcome to Oakland Is. My name is James Cagney, and our guest today is Oya Kali. Oya is the program director for the Strong Roots Health and Wellness in Ghana. Oya, welcome to the show. Thank you for coming to Oakland Is.
Glad to be here. Thank you.
What kind of work does Strong Roots do?
Well, Strong Roots is a community development organization that is based in Ghana. So we were founded in 2006 by a group of community members who wanted to have a positive impact on the health status of our community members in the Volta region where we operate. So at this point, Strong Roots is focused on just doing just that, strengthening roots in the community, making sure that we as people, like plants, are healthy, that our roots are strong, that we're firmly holding on to the planet, that we're balanced.
What is it like in the area of Ghana where this organization is set up? What is it like for the community of people there, and what were you trying to bring to that area?
Yeah, our community is really rural. Okay, so we're located in the Volta region, which is an area of Ghana that I won't say is forgotten about, but it is it's densely populated with vegetation. It's the source of hydroelectric power in Ghana, the Volta River, and it is filled with a rich culture and beautiful, beautiful people. For us, in our community, 70% of our population is either under the age of 15 or over the age of 60, which is a very challenging situation when you look at those who are most productive as it relates to economics and economic development of a community are actually living outside of the community. They've migrated to Accra, the capital city, in order to look for work or education, or even as far as overseas. So in our community, there is a lot of need for health programs that seek to deal with these populations, looking at young children, in terms of nutrition status, in terms of immunizations, or just preventative measures to ensure healthy development in their formative years, as well as a lot of chronic care management programs for those who are over 60 because of the agricultural, or because of the environment. The majority of people are involved in the agricultural sector, which means that a lot of our elders are actually suffering from a condition known as polyneuropathy, or conditions where you have nerve damage due to compression of the spine. So if you can imagine people in Ghana who are part of the agricultural sector, a lot of times they're carrying on their head loads, 50 pounds, 70 pounds, 100 pounds of firewood, cassava, you name it, in a basket. And so over time, over years, some starting as young as 5 and 6 years old until they're 70, 75, we still have people in our community farming at 80 years old. So the work was a work of passion, a work of desire to see change. We had far too many people in our community dying unnecessarily from illnesses that were totally preventable.
For example, what would be your approach in dealing with people with compressed spines? Because what you're talking about is, a cultural thing that's passed down generationally.
Right.
How do you help solve that for the community that is there?
That's beautiful, and that is actually the essence of what we are. So Strong Roots is a health and wellness center, and the wellness piece is where we are the strongest. So my background is I have a background in public health, which is health education, program planning and development. I studied here in Berkeley at UC Berkeley, and really had an opportunity to pick up a lot of valuable skill sets as it relates to empowering a community, building capacity. So for example, at this point, our main focus is educating, is preventing the ill health. So we do a lot of that. We do a lot of programs that focus on making our community members more aware of their body internally, our organ systems, our skeletal system, how it functions, how the skeletal and nerve system interact, how damaged spine can then lead to damage in your extremities. So at this point, our main focus is education. We are actually looking to develop our program to do more curative services, but at this point, our primary focus is prevention.
Gotcha. Because I'm like, what kind of solution would there be to assist people and to make sure that in that community they, at the very least, among all of the other health issues, that their spines and bodies would remain healthy and supple, considering, you know, how their community is set up or established?
Well, it's very interesting. I mean, one being that we're a mountainous community. So we're located about 3 hours outside of the Volta district capital, which is Ho. H-O is how it's spelled, and on the road to another town called Hohwe. So we're located in a very mountainous region of Ghana. And in that sense, just walking from your home to the store requires a lot of manipulation of the spine, if you will, just maintaining balance on an inclined plane at a constant. I mean, we're constantly moving up and down and altitude levels just to go to school or go to the store. So for us, it's inevitable, especially given that 95% of the people in the community are depending on agriculture as a source of income. So this is where our challenge lies. How can we improve the health of our community without being detrimental to their livelihood? I mean, we can't tell people, okay, don't farm. What alternatives do we really have at this point? So in that sense, the best thing we can do is to empower them to be more aware. We take a lot for granted in the U.S. in terms of public health information. So, I mean, if you think about people who work in UPS, a part of your training is being taught how to properly lift. You know, we don't pick, you know, with our back, we pick with our knees, and a lot of that is not common knowledge.
Gotcha.
So that's where we start, making sure that everyone has a level playing field, if you will, of understanding about how their body functions and how our environment and the society that we live in can impact our health.
How and why was that particular area in Ghana chosen as a connector, a representative for Strong Roots?
Right. Well, we held a proposal, if you will, request to our community. So we're primarily focused on the Volta region in Ghana because of descendancy. So my roots are coming from the Volta region, from the Ewe or the Vegbeto community. And so it's really important for me to give back in a meaningful way to the motherland. And so in the beginning, Strong Roots Ghana, which is the parent or the umbrella organization for Strong Roots Health and Wellness, really wanted to get involved. And so we had a formal, informal proposal request in the sense that we dealt with our immediate founders, the people who were involved in founding the organization, and identified communities that we were already connected to that really needed support. So several things came up. A school, fish farm, you know, and a health center. And so what we did was actually toured the communities and looked for the ones that were in most need. And so the community that we're working in, we were invited by the then headmaster of the primary school to support. And even in visiting the community, in the short time that we were there on our initial visit, which was like maybe 4-5 days, there were like a series of deaths. Like 4 people died from stomach ailments, which actually turned out to be guinea worm infection from an unclean water source. And it was really painful to watch. Like, You mean you're dying from something that can be cured with a pill that costs less than 50 cents? Are you serious? And it was just a call to action. So we immediately said, no, this is it. This is where we're going to start. This is where we're going to plant the seed of Strong Roots, to say our first undertaking as a local nonprofit in Ghana is to strengthen the foundation of this community. And so our ultimate goal is helping our community see that your wealth comes from your health. A lot of people are focused on getting out of the village and getting into the town, coming abroad. But we're saying if you cannot maintain your health, it doesn't matter where you are in the world. You know, health should be our primary goal, and that is our goal. So we've just been working since 2006 to erect a center, which has now happened. Our center is established, building is there. Okay, then it was preparing the building, sensitizing the community. So we have health educators now trained in the community, regularly disseminating information at like community events, going out. We have a retired nurse in the village from the Ghana Health Service who's doing minor curative work, first aid, and pretty much like hospital referrals. So, you know, going out, visiting the homes, seeing what health conditions may exist, and providing services in that way, in a very grassroots oriented way. And at this point, we really want to elevate ourselves to the next level and be able to hire a full-time clinic officer, either a nurse practitioner or a medical doctor, to actually come from the capital or another major town and move into the village.
Gotcha. And
be able to provide services on a 5-day-a-week, if not 7-day-a-week basis.
The work sounds and is beautiful and necessary and essential. And part of me wants to ask, how was your approach initially received by people in the community?
Oh, yeah.
Because the kind of like the devil in the back of my mind is like, well, technically as Americans, you're outsiders. What can an outsider bring to this insulated community?
Right.
Why do you guys have an answer that we in our own community do not?
Right, and then let me clarify that. So I'm here as a representative of a nonprofit organization that is based in Ghana, but it is not an American NGO.
Okay.
So it is a local nonprofit. I happen to be one of the only people on the board who has, let's say, U.S. documentation to travel in and out of the country. I've had the opportunity to go to school here, and actually my motivation for even attending public health, School of Public Health at UC Berkeley, was to receive training that would allow me to be a resource. So our project initiated in 2006, and I came in 2008 to study public health, to then carry back education as a resource. And that is really the essence of why we're here today, is to talk about the importance of grassroots infrastructure development on the continent. It is so crucial for our people living in the diaspora, scattered across the globe, especially living in developed nations, quote unquote developed, having access to free education, to technology. Even this is a resource. So our goal is to let people see how easily it is, or how easily development can happen on the continent with just a drive to see change.
Certainly.
So we are an organization based in Ghana that seeks to build capacity internally.
Got you.
And so that is what we are doing.
Yeah, because I was going to ask, like, what was the East Bay connection to that group? And it feels like it's basically you.
Me,
Yeah.
being a student at UC Berkeley and loving the Bay, being a part. I mean, I have many homes. I'm definitely a Garveyite in the sense that I don't ascribe to geopolitical boundaries when I define my identity as an African. I claim it. Sure. The whole continent, all of us as one body, breathing, moving with that same pulse. Respect. That is Strong Roots. Our essence is saying, let us tap into our roots, into that field of oneness that connects us all, so that no matter where we are on the globe, we can be here in Oakland and have an impact in Africa.
By us in Oakland doing what?
By us in Oakland, one, being aware. The first step to making a change is being aware of the problem, being aware of the issue. Far too many people of African descent in this country don't readily identify with Africa, primarily because there's not enough images in the media. What do we know? Africa's poor, people are starving, people are dying, and that can be the case in certain situations, but that is not the majority of what Africa is. Africa has many developed cities. Africa has a lot of wealth. And our goal is to help people understand that wealth can be cultivated from right in your community, right here where you are. You do not have to leave a rural setting in order to attain wealth. So Strong Roots primarily focus in rural settings. Our goal is rural development, and health is the foundation. If you are not healthy, how can you farm? How can you develop? How can you educate? So at this point, our goal is educating our community, both here in the Bay Area, about grassroots infrastructure. First of all, I really just want to say what we mean when we say infrastructure.
Please.
Because we, again, take for granted that when we leave this building, there's a sidewalk for us to walk down with a crosswalk and a stoplight. There are lights. There's running water. Every time I want to drink a bottle, I can go to the store and it's well stocked. I can turn on the tap in my house. I don't have to heat my water on the stove or outside. That's infrastructure. Infrastructure is what allows us to move with such ease in America, and it is so lacking. So when we say developed world, what we're talking about are regions of the globe where people are living off less than $10 a day. 80%. In 2005, the World Bank did a study. 80% of the globe, 80% of people living on this planet are living off less than $10 a day. That's unfathomable. And 50% of all people, so what are we talking, 3 billion people, survive on less than $2 a day. How is that possible? So put that into context when we're saying strong roots. What we're doing is seeking to empower these individuals to know that although you are in these forgotten regions of the world, we know your story. We recognize that we are all one. We are connected to our source, which is Mother Earth, and in that sense, we are all trees. We should all have our roots firmly locked in with our motherland. As Africans, with our source of existence as human beings, with each other, as divine reflections of each other. So Strong Roots is a passionate venture. Our goal is to build capacity by infusing in our communities where we're based a sense of pride, a sense of empowerment in the role that we play in making a difference in our life and the lives of others.
Pride sounds like part of it, and I want to ask, as far as like drawing from roots, you know, what can we in this community in Oakland, since we're here now, what can we learn from the work that Strong Roots is doing in Ghana? What can we do and apply for ourselves that you've seen is really beneficial to the community out there?
Well, it is very important for people to understand that the globe revolves around our desire to see good. Like really what motivates life on this planet is love. And so we're tapping into our love. Actually, we're going to have an event coming up really soon where people in the East Bay who want to get involved can come out. They should check out our website. I think it'll be listed at the end. We're Strong Roots Ghana, GH for the abbreviation of Ghana.webs.com. And we're going to actually have a community event known as Crossroads Africa, where it's an opportunity for people in the East Bay to learn more about the work we're doing and to pour in resources. At this point, what we need are resources in the form of technical advisors, people who have medical training, who are willing to come and train. We're looking right now, we'd like to start a community, like a nurse assistant program, similar to like a CNA program here, where we can train more of our younger generation community members to provide elder care for our elders. But in terms of lessons, is that anything is possible when we come together around a common goal. And we have a common goal in our community, which is strengthening our roots and improving our health status, so that no more will we have people dying from guinea worm in our community when we now know that a 3-day treatment costs 50 cents.
That's crazy.
You know?
What kind of diets do the people in West Africa have?
Oh, very healthy. In that regard, we're ahead of the game in terms of diet. We are very agricultural, so a lot of the food is straight from the earth. A lot of yam, a lot of, as they call, tubers or root crops, yam, cassava, a lot of plantain. So in terms of diet, we're really ahead of the game.
Gotcha.
That is one of the strengths of our communities, is that people are very healthy in what they consume. We could possibly do away with some excess oil. We do consume a lot of saturated oil in the form of palm oil, but even palm oil is rich in copper and iron, things that strengthen our system. And thank you for saying that, because at our center we do cover a lot of that. We do talk a lot. So our 4 major health programs in terms of health education right now are child nutrition workshops for children and parents. So we actually have child nutrition that's designed for school-aged children to be more aware of what they're consuming and calories and macro and micronutrients, as well as for parents. And nutrition is also built into another one of our programs, which is our prenatal care. So we do a lot of health education with our pregnant women and reproductive age women. So in the U.S. they're terming it preconception care. So our prenatal class is not just for pregnant women. We are dealing with all reproductive age women, which is between the ages of 15 and 49. We also have environmental management workshop, and that is where we bring in lowering like infection or risk of infection for things like malaria, which is a waterborne illness, which is born from, you know, a mosquito, and mosquitoes' breeding ground is stagnant water. So we talk a lot about managing our environment, covering open water, maybe boiling water to prevent other types of bacterial or parasitic infections, as is the case in guinea worm. And at this point, the majority of our community is dependent on the local well or stream for their water source. So we try and help empower our community to manage health by being more aware of what health is or what constitutes health and our body. So, you know.
Is your organization, by the way, at all doing like well construction or doing specific work with water in that area?
That's a great question. At this point, we are seeking more sponsorship. So from 2006 until now, everything that has happened has been self-sponsored from within the community. So all funds for building the center up into its present state has come from within the community or from funds that I've been able to support as the program director. So my job as program director is helping to develop programs, and a part of program development is seeking funding so that they can go forward.
What is the funding, raising funds to support this project like?
It's challenging. A lot of it has, at this point, because we focus primarily on grassroots. That has been our motto, and we're looking to really push that model of development in Africa. So we have done a lot of work with our school children, making arts and crafts with some of the women's, you know, sewing clothing items that can then be sold here in the U.S.
Gotcha.
But at this point, we really would like to expand. So we're registered as a nonprofit in Ghana, but we would like to develop a parallel sister organization here in the U.S. so that we can begin to leverage international aid funding from, you know, organizations such as, I guess, U.S. Aid or other large organizations that would be able to give us the amount of money that it would take to really expand. Our goal is to develop a hospital in our community. The nearest hospital from our community is about 3 hours from where we are, and the majority of our constituents cannot afford to make the trek, let alone to cover the cost of healthcare once they reach the district capital. So our goal is to really establish a fully functioning health center and have that grow into a hospital.
And really quickly, just for myself, what I wanted to jump back just briefly to sexual education in that particular area, because the biases that I get through the media reminds me that AIDS is an issue in Africa. Is it so in that community itself?
Well, not necessarily in our community. Our community is really close-knit, and at that, as I've mentioned earlier, at the point in which people are most susceptible to the disease, between those reproductive ages of 15 and 49, the majority of our population in that age range are actually living in the city or living outside of the village. So given our current population structure, AIDS is not really a concern because the age of the population isn't there. Having said that, we do still offer aspects of, as you call it, sexual or reproductive health education in some of our other workshop series.
Gotcha.
So we do have a series that goes over the organ systems. So there are like 12 major organ systems in the body, reproductive being one of them. So we bring in sexual health or prevention of sexually transmitted diseases within that workshop.
What are your goals, say, in the coming year that you would definitely like to see manifested through Strong Roots and through this group?
In the coming year, we would definitely like to have more partnerships with grassroots or community-based organizations outside of Ghana. So this is our push right now. As I've mentioned, in a couple of weeks, we'll have a fundraiser and community event happening here in Oakland at Sheshemani Bar and Grill. So if anyone is interested, they can look at our website to find out more. It's Strong Roots Ghana, but Ghana is GH, so it's strongrootsgh.webs, webs.com. And in the coming year, we would like to have a full-time doctor on duty to assist the nurse that we already have. We would like to have, as I've mentioned, more community partnerships. We definitely need more support, not only from our government, so we're pushing for our government to also take a more active role. Realistically, our government should post a doctor there.
It very well should.
Right.
I'm sorry that it just doesn't do that usually.
But
I don't want to cut you off. We just actually run pretty much out of time. I know we should actually come back and do like another session with you because there's so many other questions
really
I'd like to
excited
ask.
about this work.
But Oya Kali, thank you so very much for coming through and speaking for Strong Roots. Thank you for coming through to Oakland Is. This again is the Oakland Is show. I am James Cagney, and thank you very much for watching.